build and grow your practice. We like the idea of platform devices because we can use multiple systems. I do Illuma first and then IPL. You're making new collagen under the skin. You're causing tissue tightening with the Illuma, and then you go and you start using the IPL to make the red, the brown, and the texture change is complete. As you combine this stuff with other treatment modalities plus skincare, then we sort of have the whole gamut of things that we're looking to treat, all non-invasively, all without a lot of degree of pain or discomfort, and without any downtime.
I like the ease of the use of the handpiece. It's very ergonomic. It's very easy to handle in your hands. It's very lightweight. It glides very easily during the treatment.
One of the advantages to the Lumenis One are having the ability to use two different spot sizes. What I find is that I use the large spot size to do a full face treatment, and then I switch to the smaller spot size to take care of those vessels, especially around the nose, which can be a more sensitive area, which I like to increase my fluence and pulse durations, and I can do it more effectively with less pain. So the advantage is having two different spot sizes to treat two different types of conditions.
What my patients like about the Lume One, that is very quick, and so they feel that they're in and out and they're back to their job. It's a lunchtime facial.
It's worked wonders for my skin, both my face and my neck and chest. It's just absolutely smoothed my skin out and just been a fabulous reaction.
We looked at 46 patients with a variety of wrinkles around the eyes and around the mouth. Really just focusing on safety of the device and did it really make wrinkles go away. We measured something called the Fitzpatrick-Goldman-Rao Elastosis Scale, which is a wrinkling scale, and it's a measurement from 1 to 6. We knew with some of the previous studies in radiofrequency devices that about 30% of patients saw some improvement, maybe a 1 degree change in their elastosis scale. We found, on average, the mean was a 2-unit change, and over 80% of the patients had at least 1 unit change, and there was like a 94% patient satisfaction rate, and the safety profile was good, so this was safe and it was efficacious statistically.
Patients love it. They absolutely love it. They love the fact that there's no need to put the numbing cream on the skin.
It felt like a little suction and a little heat.
And what we tell patients is we can typically complete an Illuma treatment in 15 minutes, sometimes even shorter, because it's virtually pain-free. You're not having to stop and let patients sort of take a breath or take a minute.
By taking the skin into a vacuum, the procedures become painless. So radiofrequency in the old days had this connotation of great results and pain. And the great results were in some patients. Now what we found is we get great results in almost everybody we treat. The procedure is totally painless. If you can get safety, which we have, efficacy, which we have, and do it painlessly and quick, then you have a winner. And so that's kind of what we see when we use the Illuma as a package for our patients.
The Illuma treatment was amazing, that they could do that much for you in that short of a time with no pain. The Illuma treatment was the easiest and fastest. I'd recommend it to anybody.
wasn't painful at all. It was just I could feel that something was happening.
I was concerned I was going to hurt, which is a little bit funny since I would go in and get it ripped off. But actually, the procedure itself was very short, and it was even less painful than going and getting it waxed.
The light shear can help you treat a diverse population of patients, including those with skin types ranging from 1 to light or medium type 6s, patients with tan skin, and patients with a wide range of hair diameters and colors.